Good day, everybody. Lovely to be with you today. And thank you for joining us for this open online briefing. We're here really now moving through August. It's the 21st. And we have now nearly 8 months into the pandemic. And I'm very pleased today to be able to give you two things. One is a restatement of the position that we have about dealing with this pandemic. And the second is a number of observations on what's happening around the world. Each time trying to make sure that we move ahead from the previous briefing whilst reinforcing those points that are most relevant for all of us. We will have a conversation today, and I've already decided that I would like to encourage you to think about the following. Firstly, the resurgence of COVID that's happening now in places that have undergone lockdowns and been able to reduce their numbers. What are we seeing in the way of resurgence, and how are governments and other authorities responding to that resurgence? Secondly, I want to talk about people who are at particular risk of COVID. I want to look again at those who work in factories that are cold. I want to look at people who are in residential care. And I want to look at the situation facing Indigenous people. I want to also spend some time discussing schools and universities. I'd like to look at what's happening to health workers as a result of COVID, and also the way in which health services are being taken forward, particularly in places where there's a threat of COVID. As always, I'm very keen to look at leadership, and some of you have heard that I am encouraging the emergence of a campaign in order to help us, all of us, get our heads around what this virus means and actually to make sense of it and then shift the way we do things. And so if I refer to campaign, it is my increasing conviction that all of us need to be focusing on what all of us need to be doing in a pretty unequivocal way. Now, in order to help us get in, I'd like to move over to Twee, first of all to say hello, but then to introduce the poll that she'd like to do. Twee, you have the floor.
Good morning, everyone. So for those of you who haven't joined us before, I'll talk you through how to respond to the poll that I'll be making live right now. You'll see on your screen what's popping up. So there are 3 questions for you to answer. So please share the first question: where are you joining from today? The age range, because we like to make sure when possible to engage as many people from different ages as possible. And then the last question, which is around how you're feeling, because this is our way of feeling the mood of the room, which is something we don't get from virtual meetings, and this is our way to do it. It uses a scale of emotions, and it's to demonstrate that there are such a big range of emotions, and that sometimes it's very hard to move from, to jump from a really difficult, hard emotion to a positive one. And so it gives you the idea that there are stages and it can take time. This last question here on how you're feeling, though, you are very much invited to answer more than once, because you can also feel multiple feelings at the same time, particularly at this difficult time. So I'm going to leave that open, and then I think we will come back and I'll share the results possibly at halftime. Thank you.
Great. And Twee continues to give us all huge joy by her constant looking for different ways of keeping people together. And I know that she's been working on the groups that we can use to connect, building up on her exchanges with Loirego in previous briefings. I'd like to just make sure to acknowledge and greet Marianne Annie NK, Chris, Sarah, Vicky, Polly, Louisa, TAN101, and Holly. Doing Godfrey, hello as well. Sorry, you were in a different part of my screen. Just to say to all of you, we are connected in many different ways. We're looking at many different issues together. For example, leadership issues with Holly, songs with Vicky, and then again, the whole issue of shifting the mindset around leadership with Chris, which is proving to be really great. Godfrey's giving us fabulous inputs of what's happening in Tanzania. I'm very impressed by the way in which the group is working. I thank NK very much for sending in regular press clippings and the like. The great thing about this is it means that we are connecting and moving together on the issues. And so if I just start at the top of where it is that I'm continuing to encourage governments and others to move, it is firstly continuing this core message that the virus is dangerous, the virus is here to stay, and it's up to us to keep it at bay. Now, every single bit of that is such an important element of the narrative. The virus is here to stay is increasingly aligning with what those who have expertise in the situation are telling me. Don't assume that any of these vaccine candidates are going to actually necessarily be effective in preventing infection. And we are still at an early stage. And even if Mr. Gates says that the pandemic is going to disappear by the end of next year, it doesn't necessarily mean it's the case. There are a lot of tasks still to be done to get the vaccine tested and then administered to people. And then secondly, we're not going to have 100% acceptance of the vaccine in the first instance. And so I think just as we've had to do with polio and with measles, we have to just remind people that the virus isn't going away and is here to stay. And I think we have to keep using the word dangerous. We have to remind everybody that to keep the virus at bay, you have to have really effective defenses. And that notion of staying safe through defense is one that I continue to say as well. With TWE and others, I am constantly working on convenient ways to make these points in short catchphrases. And I'm going to go on doing that because I hear too few people confidently articulate that staying safe in the face of this virus or indeed any other communicable disease is about being able to defend ourselves. And the defense characteristics are pretty well known. I'm trying to avoid military metaphors, but at the same time, being on the defense is the key part of getting ahead of this virus. I've said to all of you before, and I want your help with getting the narration of this right, that there are some strategic principles that need to be applied everywhere when dealing with this virus. And those strategic principles are universal. I really got to know these strategic principles when Bruce Aylward and team came back from China in the middle of February and said very clearly, there are things that everybody has to do. And then I've pulled them out a bit, but just to remind, universal precautions. Really, everybody doing physical distancing, face protection, hygiene, particularly cough etiquette and hand hygiene, and then isolating themselves when they have symptoms. I actually think that if we can get these universal precautions practiced by as many leaders as possible and actually adopted into normal behavior by most people, it'll be tough for several months, but we will be able to actually reduce the incidence of this virus. And the virus doesn't get bored, it's humans who get bored. And if we can just remind everybody that just as you can't get bored of wearing a crash helmet on a motorbike, or wearing a seatbelt in a car, or using condoms in sex if that's appropriate, you also should not get bored of taking the precautions needed to stop the spread of this virus. Well, we'll get that in. I mean, if people will fight it and do bravado and so on, but over the weeks and months, it'll come on board. And I'm just wanting to push that notion of universal precautions. I also want to really remind everybody about public health, health in the community that's capable of maintaining surveillance over illness. That's the second absolute need. And the third, which I'm separating out, but because I want to emphasize it, is the importance of integrated local level action rather than fragmented action. And actually investing in getting that integration right is worth it. Fourthly, getting health services all the time subject to focus so that they can function even in the midst of COVID. And I mean, that is possible. And if we don't do so, then people will unfortunately succumb due to other conditions or just be massively inconvenienced. There's a report in from Plan International that I was reading. I just want to quote it to you, just saying that millions of women around the world have lost access to contraceptives and abortion services because of coronavirus. So across 37 countries, nearly 2 million fewer women received services between January and June than in the same period last year. That's a report from Marie Stopes International. And I want to keep highlighting these and similar issues because maintaining essential health and other services is key. I think we need to continue to put priority on all those who provide care. The providers need protection and we need to protect them because what we know is that providers will go on working and expose themselves to danger if the need is there. And so ensuring that they access the protective equipment they need and are protected against physical and other violence as well as stigma is really important. I'm putting in my 7 strategic elements, the business of communication clearly and consistently, because again, masses of evidence now that leaders who don't communicate consistently are leaders who create the conditions within which not just dissent can occur, but actually advice is challenged and people think it's clever to say that the experts have got it wrong. And then my 7th one is the need for performance assessment. I am going to be rigorous on this. Simply measuring numbers of cases is not good enough. It's important, but what you really need to know is whether the response mechanisms are working. And we have a set of 7 indicators that we are putting in place for that. So universal precautions, public health services, integrated local level action, essential health and other services, paying attention to all those who provide care, communicating clearly and consistently, and demonstrating the performance of responses. Now, overarching all this is, remember, COVID is a disease of poverty. I perhaps need to stress that more. And so these will be the elements that we'll try to take into the campaign idea of trying to encourage leaders everywhere to align behind these strategic principles and the actions that are needed to make sure that they happen. Let me just talk a bit about what I'm seeing around the world and offer you my snippets, and then encourage you to provide your snippets in the discussion. And also, if necessary, and if you think it's you've got a point you want to make, let's have a bit of debate and we can bring more people in. I'm also inviting the team members who are on, particularly Catherine, who's sitting next to me here, and John, Twee, and others who are on or who might have come on. Don't hesitate to just engage as well, because I want free-flowing discussion. So right throughout Europe, cases are surging up again. They're localized, as we've always said, outbreaks are local, but they're coming back and they're reported often in quite garish language in the press, but of course picking up a small outbreak that's starting, cluster of cases in a factory or in residential care, is not something that should be subject to adverse criticism. It's a good thing. That's what everybody should be doing, is being alert and picking up cases. And once you've picked up the cases, then working out why there's an outbreak and which particular people are involved in its spread, and then bringing people together and working with them to connect with those who are involved in the outbreak and helping them to suppress it. This is good practice. And so in Ireland, it's happening, and it's based around food processing plants. It's happening in Italy. It's happening in Spain. Sometimes in Italy and Spain, it's associated with tourism and holiday activity. Sometimes it's associated with what's happening in residential accommodation, with people gathered together, sharing illness with each other. But the resurgences are happening, and all I'm saying to everybody is don't be surprised. This is what you should be expecting. The virus did not go away. We have to deal with it. And in fact, surges are happening all over the world. They're happening in South Asia. They're happening in Africa. They're happening in Latin America, Middle East. And that is the normal behavior we're going to see. And so rather than say, as soon as the surge happens, we lock everything down, I'd rather people say, we've got a surge. We've identified where the outbreak is spreading. We've done careful work with our testing. We've done careful symptom checking. We've got teams in there encouraging those to isolate when they've got signs of the disease. We're doing contact tracing, because when you're down to low numbers, it's absolutely essential to have the contact tracing going. And we are doing everything we can to contain outbreaks and to stop them spreading. I suppose what I'm trying to say is this must be the habit everywhere. There are places that are really struggling though. I got messages through from Nepal yesterday saying that they have so many cases coming and they are finding it very hard to cope with it. They keep saying, well, perhaps we're going to have low death rates and everybody's hopeful of that. But in poor countries with limited capacity for people to isolate, limited capacity therefore for physical distancing as well, it's hard to really get these outbreaks suppressed. And you don't want at the same time to just stop economic activity, because people just get really poor. And so the conundrum facing the government of Nepal and the Minister of Health is a big one. And we had a discussion with colleagues from the NGO Imperial in Bangladesh, who were saying, well, the real problem in our country is in urban settings, because that's where people really are crowded together. It's not so much spreading in rural areas, but in Bangladesh's urban settings. And they were telling us we've got a lot of people providing healthcare who are infected as well. So it's hard work. Let's go to South Korea. Well, there, it's interesting that the spread has been associated with religion and with people going to church. And I suppose that's something we've got to be ready for. A church is a place where people are close. Often it's quite a confined space. They come in from all over. And so in South Korea, there have been, I think, 3 instances of spreading of the virus associated with religious services. I think, therefore, to keep in our minds that it's factories, it's services, it's places where people are gathered together because they have to be, for example, prisons. They are very, very spreading places. Then slums. Just knowing that these are places where the virus is likely to spread is absolutely key for public health policy. And I would like to encourage more and more that focus on who gets infected and where they're infected and why they're getting infected as part of the local level detective work that is key to getting on top of it. As we go to Latin America, perhaps the good thing to say is that more and more we see evidence that governments and their people are getting on top of it. Actually, I find that when efforts are made to reduce the opportunities for people to be in contact with each other, you can quite quickly reduce the rate of spread. Your doubling time increases to 10 days or more. And you even can get to a point where actually outbreaks just subside. What's called the R0 drops between 1. And so don't ever give up. If you're in the middle of a really big outbreak, small shifts in people's behavior can really lead to good results. And so let us keep focusing on the importance of physical distancing and respecting the virus as much as possible. I think if testing is being used to help establish where the virus is, it's really important to get the test results back quickly. I've got more and more people telling me that they've got 24-hour delays in test results coming back, or even 48-hour delays. Well, you can't ask people to organize their lives around coronavirus if the test results are coming back slowly. And so as part of the campaign, really improving the responsiveness of testing and improving the accessibility of testing and getting new tests on stream fast is really important. Let me now go into some of the specifics before I stop and we go into the interactive session. Indigenous people. I've said several times that with these kinds of infectious diseases, Indigenous communities suffer the worst. Julie Hall and I, when we were working on H1N1 influenza in 2009, saw time and time again that Indigenous people in different parts of the world had a much higher fatality rate. And some report from the Centers for Disease Control in the US, with Robert Redfield, the director, quoted, says, American Indian and Alaskan Native people have suffered a disproportionate burden of COVID-19 illness during the pandemic so far. I mean, basically, it seems to be something like 3 times risk of disease in terms of incidence per 10,000 in the population. So it's a 3.5 times risk of disease. So we've said before that in many societies that have multiple ethnicities, those who are Black and those who are Asian or Hispanic have both a higher incidence of disease and a worse outcome of the disease. So we now add to that group Indigenous people, particularly well documented in North America. We've also got documented excess mortality among Indigenous people in Brazil. I keep thinking to myself, 10 years' time, when history of all this is written, and we find that there's been just whole communities hollowed out by this virus, as happened in 1918 with the Spanish flu, we'll be asking ourselves, couldn't we have done more when it was happening to stop this? It's a sort of weird thing, this time lapse between what's actually happening and when the history is written. And so I'm really trying through these online briefings and through other work that I'm doing to highlight things that I think represent history in the making. And this really high level of disease among Indigenous people is important. Linked to it, other more anecdotal information that in these communities, the biggest burden is being felt by women and by children, though actually the mortality may be more by men. I wanted to spend a moment focusing on schools. It's an area that we've been looking at. It's an area that my colleague Catherine has been looking at as well. And I thought that it'd be interesting if I could ask Catherine just to turn on her video and unmute herself. It may actually, she probably can't unmute herself, but we'll find another technique. So Catherine, just a quick summary of where things are in your work on schools, and in particular, say 3 bullets of advice that you might give to people at the moment. I'm not asking you to advise in terms of specifics, but as they're conceptualizing this issue.
Thank you very much, David. I think the number 1 recommendation / piece of advice that's out there that we need to be listening to is that which came from Mike Ryan and Maria I'm going to say her last name wrong. I apologize.
Vankakova.
Regarding treating schools as part of a community, and that any actions taken to reopen schools need to be taken in the context of the viral load in the community. I think the second piece that I've seen that I thought most useful was to consider different kinds of schools as having different kinds of problems. So for instance, the challenges around managing students and teachers in a primary school or elementary school circumstance will be different to those in a secondary school, and then different again to university contexts. Particularly in universities, for instance, you have dormitories and need to be thinking about close quarters, and where in primary schools you have children that are young enough that compliance with things like masking or hand washing will require substantial oversight. And I think the third thing that has just recurred to me over and over again in reading and in thinking about it is that we talk not enough about how at risk the people who work at schools are. And that doesn't just include the teachers and the professors, it also includes all of the maintenance staff and the janitors and everybody else who works to support a school and make it run, the administrators. So those, I think, are the three highlights that I would emphasize today.
And where would you go, Catherine, if you were looking on the web for a sort of sensible guidance that really helps you through this? Some sort of framing guidance. Where are you finding the best stuff?
I really liked the European Centers for Disease Control, the ECDC guidance and recommendations. I'd be happy to put a link in the chat.
Cool.
Would be useful.
And lastly, just on schools, presumably we're just going to have to accept that schools from time to time will have to close if there is a local build-up in cases because of this advice from WHO that you have to look at schools within their community setting. Is that I think your view?
I think that's probably true. Like any functioning unit of a community, if there's large-scale outbreak or large-scale virus, schools should be treated no differently than restaurants or other places where people gather. So if you're concerned about people gathering in restaurants, you should similarly be concerned about people gathering in schools.
Got it.
I mean, that's what I would say.
And we're also being really helped, all of us, by Hans Kluger, the regional director of the World Health Organization for Europe. He's got two things that he keeps really paying attention to. One is the challenge of schools and the dialogue really between the education ministry in a country and the health ministry, and everybody trying to do their best to make sense of it. And the second thing is how to help younger people, particularly in the 20s and 30s, to understand that they are involved in the whole process of transmitting the virus. And even if they don't get bad symptoms, how to help them to actually moderate their behavior so as to have lower impact on older people. Super tough stuff. And I don't think any of the issues we're dealing with these days, everybody, are easy issues. So I'll come to another one. Again, Catherine and I working on it, but together with Florence, is what's happening in these cold factories. Meat, fish, sandwich making. Just this is UK obsessed with triangular sandwiches, and there's been a sandwich making factory in Britain that got it. And also garment factories, so not all entirely coal, but the cold ones are a particular problem. And so why? So there are issues in these plants that are human, and there are issues that are to do with more mechanical things than the transmission of the virus. Let me just start with the human one. If I am low paid, if I am only going to get my money if I go to work, and I'm going to get into trouble if I take time off work, I may lose my job even, I am going to feel pressured to go to work, even when I'm not well. I'm certainly going to feel pressured to go to work if I'm really well, but just simply told to stay at home because I've been exposed. people will work. They've got to pay their rent and so on. Now, the only way that they will not work if they've got symptoms or they're being asked to isolate is for they get compensation. But we've seen all over the world that it's really hard to compensate people who are isolating. And in fact, in some countries, people have been asked to pay for the cost of their isolation. So there are sort of double disincentives. But I think in the end, this is so important that if there's a disincentive to isolation, people will not isolate. But if there's an incentive to isolation, then they will. So talking to Lothar Wieler of the Robert Koch Institute in Germany, he has just said time and time again, it has to be financially rewarding for people to do what we want them to do and not the other way around. And I think this is a big issue in these cold factories because people work incredibly hard, long shifts. They're usually quite low paid. They're often what we call agency workers, which means that they're moved in groups from factory to factory. And the whole process of ensuring that they stay at home when sick is really hard to manage. But we have been through it. We've managed to speak to some unions, representatives from the different unions that are involved in this work, and they're saying, well, it is possible, but you have to get the incentive structure right. And if somebody only gets 1/4 of their normal wage when they are on sick pay, then they are not going to take the sick. And so we've got to look at the incentives for people staying away when they're ill in these kinds of operations. Secondly, there's something about these very cold factories which seem to be associated with explosive transmission. Really big outbreaks, giant numbers of people infected, whether it's meat plants or sandwich plants or fish plants. And so is there something mechanical going on? And yes, there are people very close together. There are people shouting very loudly because they're noisy places. There's a lot of peculiarities about ventilation because you've got, it's refrigerated, so you're pumping cold air around. But if there's something not quite right about the filtration, then there is a possibility that you're pumping particles around as well. So the ventilation questions, which are likely to be factory specific, are also being looked at. So in summary, there's something about these cold plants. There's something about the working conditions, at least I'm talking about many parts of the world, in Latin America, North America, Europe, Australia, New Zealand, Middle East. There's clearly something about the working conditions in these places. Plus, there may well be things about the ventilation. So we're continuing to look at this, and it's a very interesting thing because obviously labour unions are involved, management is involved, government is involved, and the public is involved as well. I mean, we will, I think, get to a point where people get nervous, and I'm sure they already are when they hear about outbreaks in food processing plants, because they'll say, can this virus perhaps be transmitted in food? And there have been these questions. Admittedly, they are just below the surface, but they're coming up as to whether or not chilled food may sometimes be carrying the virus. That's a question in China. So we talked about various communities at risk. And I do want to, last group, really focus on health workers. I don't feel bad about bringing it up again and again. And remembering, when I say health workers, I don't just mean doctors and nurses. I mean everybody involved, because of all the data about the numbers of health personnel who are getting sick or dying. And also, I mean, they're getting sick and dying in the institutions or around the institutions, but they're also bringing the virus between work and their homes. So you've also got circulation of the virus in the homes. The virus detective work points out to these things. As we get more, I say, sophisticated, we will be better able to identify people at risks. and then to be able to get the testing regimes right, but also the employment climate right. Because I just to go on with my hobby horse, dealing with these kinds of issues, it's not possible simply through issuing instructions and commanding people to behave in particular ways. These are issues where there are huge interconnections between what happens in the workplace, in the home, in the worship place, in the community, with the members of parliament, with the companies, with the public health services. There's so many different actors involved. It can't be done through the usual push down of instructions from the crisis manager. There are so many interlocking pieces. The jigsaws are complicated. They are systems that are interacting. They are very much needing to be looked at and the place where they are active. And so systems thinking, systems leadership, but that living systems leadership that puts people at the center is so, so important. And I want to weave that thinking into the ideas for the campaign, and I want to let that campaign grow. So now I'd like to move to you and to hearing from you and a little bit more interactive. So Annie Feltham and I have been having not just these opportunities to interact during these sessions, but also we've also been communicating separately particularly through email. And Annie is interested in social networks. I mean, she's interested in the way in which the virus interacts with human social networks, but she's also interested in the way in which we use social networks to actually get ahead of the virus. I think there's a huge amount in what you've got to say, Annie. I'd just like you to come in a second, then I'd like you to hand over to Marianne, if you don't mind, because it'd be nice for Marianne to look at it the other way around and say, okay, so the virus is interacting with our social networks, but what's the virus going to do to our social networks and to the way in which they come together through our cultural ties? And so both of these, I think, are areas of great interest. Just Annie first and then Marianne.
Thanks, David. Yeah, I'm still talking about trade-offs. And I was pleased to see Marianne's, because I think we're talking about the same sort of thing. And I think what are we doing to our kinship and social networks? I think we're damaging them, or the virus is damaging them. And so that we're getting all of these unintended consequences. And I can, even though the virus is low in the part of England I live in, people are afraid to meet each other. Yeah. I think working from home is vastly overrated as a social activity, and so there's a fraction going on, and I think it could get in the way of solidarity, which is what we need to respond to the virus. But there's a very practical one, which is I highlighted, which is the Department of Health is pushing GPs to be virtual by default. And there are all sorts of problems with that, which you know better than me. And so they can't be the gatekeepers. And therefore that will reinforce health problems as we go through. And we still have no idea about the mental health impacts of what we're doing to each other by our social distancing. So I think our messages are really important. But I'll stop there, because I'm also interested to hear what Marianne has to say about the culture side of it, because I think we're talking about the same thing in different ways. But I wander across the group where we can shift the balance so that we're considering these other aspects of our social life and working out how we get a balance between combating the virus, but not making people so fearful that we're becoming ill or unhappy in different ways.
Thanks very much, Annie. Marianne, please.
Thank you. I was trying to ask the question, but more than try and answer it. But the point is that looking at the way things are happening, this is from a UK perspective, but as lockdown is eased, what do they open up first? The pubs, the public houses, and the bars. And there's that perhaps one needs more in the way of a plan about how you come out of lockdown and how you deal with things in the future. Because what it looks like is going forward, you won't be able to go to a musical event because small theatres can't afford to have the physical distancing that's necessary, and you can't expect artists to perform twice a day so that the same number of people can enjoy an event. But it seems to be that everything is very piecemeal, and it's heavily, obviously, with an economic bias. But we should be looking at a holistic approach as far as individuals are concerned. And I was wondering, and Godfrey came back with some suggestions, who is actually looking in any detail at cultural aspects? Thank you.
Thank you. And so, I've number one, the focus on isolation and distancing threatens many aspects of our social relations and will potentially harm us unless we watch it, and his point. And then secondly, as we collectively do come out of lockdown, it would be worthwhile thinking quite systematically about the remaking of society, but adapting to some of the new realities. Can we do that? And thank you both. And I think what you're both also implying is this is relevant in every culture. This is not just restricted to any specific country. I'd love to hold on to that and to just recognize that this is important. I think, by the way, naming something is key when we're trying to go into this kind of work. So thank you both for naming it. And just want to say that as we do name things and isolate them, just like we've done with schools, like we've done with the coal factories, we will bring the issue back in further online briefings. And the relationship between the new COVID-ready behaviors and how society functions is, I believe, one that we will come back to. And Marianne said, is this on the radar of any international organizations? The answer is I don't know, but now I'm alerted. I will look out for it, and I hope you will. Now, I've got here a note, but Catherine, did this come from you or did this come from somebody on the thing? So Catherine, unmute and tell us what you've just found out, because this is important. Tell us what it's doing.
So
you're on mute.
Yes,
because I'm
on
near the
mute,
mic.
but
Yeah,
if I unmute, we'll
yeah.
have that problem. So I was just looking up UNESCO, who of course is the sort of international agency that I think of first when I think about cultural heritage, having been in the UN system for a long time. And they have a global movement that they've called Resiliart, RESILIART. I'll put the link in the chat, but they note very clearly that we are in what they're calling, the words they use are, today we are experiencing a cultural emergency. And they've launched this movement joined by cultural professionals to shed light on the current state of creative industries. So I'll put that in the chat, and you can take a deeper look, and I'll keep doing a little bit of research to see if there's other similar.
So Catherine, if the campaign idea does pick up, and I think it will, it's only a matter of time, it's a rolling stone, it'll get some adherence, then I think that groups that really will want to be part of it are those who are involved in culture, whether they are in theatre or in music, and in education, because they will realize that unless we pay attention to this, we will be in great difficulty. So we need to work that into the campaign thinking. Okay, so now I'm going to just go on. Like others of you who are involved in arts, in music, in any aspect of where you're connecting with people through their social networks, to be ready to just come in now, because although it's a difficult area, especially for people who are perhaps not dealing with this full time, you know, if we don't find ways to integrate COVID readiness into cultural aspects of life, we're going to be in difficulty, because we will face the thing of people saying, well, we'd like to be able to get our village or our town to be more COVID ready, but this means we've got to physically get together. And because we can't physically get together, we've had to put all this on hold. And so what you will get is atomization. You will get people separating, fragmenting, and we've got to be clever enough not to let that happen, because when we fragment, we're not good. And you know, if we are, which we all are, I believe, trying to focus on the destruction of nature and climate change, both of which terrible emergencies and all sorts of bad data coming through, particularly right now on climate. We need to keep that capacity for collective organization and solidarity, despite some of the distancing rules and the fear. I had an email from Onkar of Swash Hind just the other day saying, our real problem in India is not the virus, it's the fear of the virus, because it's forcing people to do things that are really countercultural. And so I do want to keep this little thing going. Now, Laura, here you are. I can see you, Laura. Would you like to unmute and perhaps turn on your video and just give us your take on this? Depending on what you say, I will either keep this string of conversation going or shift to another one. But because I think this is particularly important, where Annie and Marianne have taken us, if there are people who want, even with sort of experimental ideas, who want to just try, don't worry, let them come out, because getting COVID readiness into cultural life all over the world is key. Laura, you have no video, but you can unmute yourself, Laura. And if you can't, if you're stuck on the mute, then let us know in the chat. So see if you can unmute, Laura. And if you can't, then we'll do it a different. Yes, you're unmuted. Beautiful. You have the floor. You have the floor. You're unmuted, but I can't hear you. So there's a little glitch in the system. Try just a little bit more. One more go, Laura. See if you can speak. Okay. So put your ideas in the chat. I see you've got problem. Thank you very much indeed. Put your ideas in the chat, and we'll just hold on that. But if anybody else wants to comment on culture, COVID readiness, intercultural life, I'm really keen to hear more about it. And I just want to stress that what Vicky and Nazim are doing it's an example, and for me at least, a very good example. And I just want to stress, it will feel jerky and uncomfortable at the beginning, the juxtaposition of health issues and culture. It'll feel jerky and uncomfortable. The work that we're doing with choirs, Catherine and I have been reviewing the new guidance to choirs that's been coming out recently, saying that, yeah, you know, people who are singing and shouting, they project further, and we have to be careful about it. And they're giving us some suggestions. So what I want to, I really want to get that further. And Holly, if you want to unmute and say anything before you go, I would love to hear from you, because I know you're watching these issues very precisely. There you are, Holly.
Morning. I just wanted to say that I really agree. And one of the things that I notice in communities that embrace connection and creativity and arts and culture in that way tend to be much better at dealing with complex, difficult issues, because they can connect ideas that were previously separate in addressing difficult challenges. So COVID, climate change, food sustainability, that way of thinking when you're being creative is something that allows you to generate something new and something different. So that was my contribution. I'm afraid I have to go and be parent now, but it's lovely to see you all.
And just Holly, just want to say, Holly, and I see the ones there, lovely to see. Holly, the work that you are doing through the various leadership roles that you have to encourage an approach to leadership that embraces new possibilities and that works through connections and creates excitement and inspiration. That's the important work. That's what will lead us out through this. So we're with you, Holly, and thank you for all of it. And whoever it is just on your left-hand side, looking great. Nice to see you. There we go. Thank you very much indeed. I'm going to now move on into a couple of other things. Laura, thank you so much for trying. A couple of other things. I want to talk now to colleagues who are in the Indian subcontinent, to NK, Lyrego, and others. Yeah, we have some massive challenges, NK, in your country about what's happening. It's quite difficult because there's not, at least as I understand it, an evolving collective appreciation of how to deal with this. It's still as I look at some webinars and presentations, COVID is presented as the enemy and it's very militaristic, the language. As I look at other material, people are saying, well, yes, you can treat it as the enemy, but we've also got to live with this virus. And if you treat the virus as enemy, you start treating groups of people as enemies, and it creates real challenges for society. So we need a different style of approach that embraces the presence of the virus as an unwelcome presence, but still shows that by respecting it, we can get on top of it. And I know you've been looking at this and you do want to talk about how different actors influence the response. N.K. Sethi used to be on the National Planning Commission of India. He's somebody who I've worked with for years. He's a prof of health and but also a keen observer of what's happening across his country. Welcome to you, NK. You have the floor now.
Well, thank you, Dr. David. Well, right now I'm not with the Planning Commission. I am a freelancer and an independent person and observing what is happening in India and globally. And on the whole, I would say there are three key players or the ones who influence the decision and the actions. It's a triad. On the top of it, politicians who eventually take a decision based on the feedback which the bureaucracy provides and the professionals provide. Now, what I have observed in the middle of it are the people of that triangle, and whatever is communicated to the people, they start believing that. Yeah. Now, it's natural for the politicians to indicate that they are doing well, they are on top of it, and no need to worry, all those things. And the professionals, in general, project a balanced view to say, like you and maybe others, that what is the situation right now, how much of it we have been successful with, and how much of it we need to do more.
Yeah.
Whereas the third part of the triangle, which is the bureaucrats, I'm sure you would recall that serial, Yes, Prime Minister, Yes, Minister. Now, what I feel, the bureaucracy knows how to tackle the politicians, and at the same time, they would not like to indicate anything to the politicians that whatever they have done has not done well. They generally have a tendency to indicate, yes, whatever has been done is fine, it's good. and rather camouflaging in such a fashion that the things are presented in a positive way. And then eventually, on the other side, the professionals keep saying, no, 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 that's the other viewpoint. Now, eventually, what things get communicated in the media or to the general people influence the action by the people. If it is projected that we are doing better than this country, or this particular province is doing better than the other province, then the people start becoming complicit. My thinking is that how do we go about communicating to the general public that yes, we are better on certain aspects, but at the same time, we need to do much more to achieve yet other things. Like,
Got it.
so in general, that's a challenge. Now, how to tackle that is something which has not come out clearly in my mind, because I'm at my level trying to address both the bureaucrats and the professionals at the highest level, and also the politicians. But then eventually, whatever the system provides them gets more credence than an individual.
I think this is super important, and I'm going to, sorry to stop you suddenly, but it's just time's running out. But NK, there is something really important in what you're saying, because there is this cycle of interaction, as I agree with you, between people, politicians and bureaucrats. And I think that quite often it becomes really rather reductionist and unexciting. And what we're hearing, and just looking at Laura's note on the chat, is that actually people are getting on and are changing their lives. Interactions are changing. And why don't we just accept that everywhere interactions are changing? Because they are. And partly because of fear, partly because of knowledge, as NK said, but they are changing. And we are working out the realities of COVID-ready life. Now, NK's point, which I really want to drive in really, is that if we do this in a competitive way, you know, saying our country is better than your country, or our city is better than your city, we will end up, frankly, very, very frustrated. Instead, we have to do it together. We have to feel the COVID-ready life. We have to be the COVID-ready life. And then I actually think we have to describe the COVID-ready life. And it is a different life. And incorporating that into culture and incorporating that into social relations is, in a way, a much bigger challenge than some of the other stuff we've been talking about. And that's what this morning's briefing has been about, is reflecting on what the COVID-ready life means for our social existence and our cultural existence. And we've had lots of good stimulus on it. So thank you, everybody. Can I go to Twee, please?
I am just going to share the results with you all. Today we have a good spread. I know that there are a couple of people from East Asia and Pacific as well, and that's because of the time zone we have today. In terms of age range, really, really happy to see we have a good spread across all of the age groups. And then lastly, on how we're all feeling, good to see that optimism remains the most common. However, I think it's relevant with what we're talking about with regards to culture here. There are two people that select at the lowest level, which is insecurity, guilt, unworthiness. You'll see those words there. And I think it's a time here for us to remember that mental health and well-being is so important, and culture is really key to us maintaining our sort of social well-being. So I think I'd just like to say, you know, we're here 2 times a week to share with one another. I encourage you to make sure you reach out to people in your network to check if they're okay. And then we can keep our conversation going beyond these on the community chat and one-to-one as well.
Thank you very much, Twee. I think you speak for all of the team who are on. Just like to acknowledge that John was on, has gone off to do something else. Catherine is on, and oh, John, you're there. So sorry, I'm being rude. Catherine is on and is here. Twee is on. My brother William has been on. Thank you, William, for being with us. So glad that you're here. John, as we close, is there any parting comment you want to make?
Just to build on some of NK's comments and this idea of competitiveness, I live in a country where everything is described as world beating, and people are pretty soon realizing that much of it is not. So the emphasis in the communication is much more on managing the message than sharing the data, and the data gets out and people will make their own sense of it. So I think it's an important thing for leaders in this to, yes, show us a direction and show us their understanding of how things are unfolding for the future, but to be really honest in the handling of that. So it's a really fine balance between maintaining hope and direction, but not being inappropriately optimistic and over enthusiastic about things where people are feeling it very differently, because then trust goes, and once trust goes, we're in big trouble.
So Andre, I just saw you. Just if you did want to make any remark as we close, we will close now, but it's wonderful to see you there. And
well, thank you very much, David. No, I don't have any particular remark to do. It was I pressed the wrong button, but yet again, a very enlightening conversation. Thank you very much indeed. And I completely agree with John. We need to be much more, we need to talk about this much more, but thank you very much.
well, that's, thank you, Andre. And I suppose that's quite a nice base for us to move on now. We dare to talk. We dare to explore. We dare to share, and we'll go on doing it. You are welcome. Stay connected. Thank you always to TWE for holding us together and giving us the opportunities to do it. But most of all, thank you to you, because if you don't do it, who's going to do it? Bye-bye.